So I'm Danny Kushlick. I am Head of External Affairs for Transform Drug Policy Foundation. I founded Transform 20 years ago. We are now an internationally recognized think tank and campaign group for, we want to end the war, the global drug war, and replace it with an effective, just and humane, brilliant, thank you, effective, just and humane system of regulation and control. So we want to see the legalization of drugs and them transferred from gangster control to government control. So that's what we do. And what I want to talk about, it touches on Nick's point earlier, is about accountability. And I want to show you where accountability completely breaks down in our policy area. Okay, I'll come to those in a moment. How does the scrolling work? Oh, you literally scroll down. Oh no, I can't do that. That's
my apologies. It's two things.
oh, you're a genius. Brilliant. So I want to talk about, I was just thinking about Tom's presentation when he put his title up. What I want to talk about is turning data into government propaganda. Because this is worse than non-accountability. This is about maintaining a system that is so broken, so damaged, that it doesn't stand up to any scrutiny whatsoever. So the government is desperate to keep data and sound analysis out of the hands of the general public. And I'll tell you some anecdotes about that later. But I wanted to start off with looking at what kind of generally agreed commonsensical outcomes would be for drug policy. Well, you'd probably want it to protect the young and vulnerable. You'd want it to promote public health. You'd want it to reduce drug-related crime. You'd want it to promote security, protect human rights, and provide good value for money. Now, prohibition doesn't do any of that. And in many senses, it was never intended to do that, despite the rhetoric. It undermines public health. It does that by encouraging poor injecting practice, for instance, and by creating very dangerous drugs in a criminal marketplace. It just kills people. A bit like alcohol prohibition did by producing bad drugs. So it kills, and often kills, young people, which is then used as a reason for maintaining, if you're a propagandist, for maintaining the current system. So prohibition kills. It clearly creates crime. It creates a market valued at $320 billion a year globally. The UK market is valued at £4 to £6 billion pounds a year. It fills up the prisons. It creates no-go areas in cities all over the world, and it unnecessarily criminalizes otherwise law-abiding people. It undermines security all over the world. If you think of Mexico, we have an office in Mexico City that we share with a partner organization. 80,000 people have died in Mexico fighting turf wars. 20,000 have disappeared. But that isn't a reason for ending the drug war there, certainly not according to their current president. And that's prohibition does that. It's again, think alcohol prohibition, but on a whole other scale. And it provides terrible value for money. One of the studies that the government did was one called the National Treatment Outcome Research Study. So the NTORS study, as it became to be known, showed that for every £1 that you spent on treatment, you saved £3.50 or something on criminal justice expenditure. So that's a real strong argument for putting more money into treatment. But it does beg the question of what value for money we get from the criminal justice intervention. That was never monetized. Nobody ever looked at that. So it's a spurious set of data. You can see how the government. Yeah, I'll chuck in a couple more as we go along. But in the absence of outcome indicators, the key that you've got to use is process indicators. So the processes are we criminalizing users? Yeah, we are. We're doing loads of that, and you can see that because a lot of them get busted each year. A lot of them get stopped, and a lot of people get stopped and searched for drugs. Millions stop and searches for drugs each year, 93% of which result in a negative outcome. So you can see there's a lot of intervention by the state there, but to very little useful outcome. Do we treat a lot of users? Yes, we treat a lot of users. We know that. A lot of money goes into that, and yes, we treat loads of them. Great. But the issue of whether that actually changes anything in the world, whether those people maintain long-term sobriety, whether their lives actually improve, whether they stop stealing stuff or not, I don't know. But yes, they've been treated, and a lot of people get whizzed around that. Have we criminalized a lot of dealers? Yes, loads of them. Brilliant. Because that makes us feel better, doesn't it? And for each one that we chuck in prison, there's 10 waiting to take their place. Doesn't work, any of it, none of it works. According to Gordon Brown, skunk is lethal. It's lethal. What? What does that mean? That's a public health message, is it? Based on what? No one's ever died from smoking skunk. It isn't lethal. Alcohol is. Tobacco is, but if you want to distort how people see the respective harms of different drugs, describe skunk as lethal, or go on and on and on about how dangerous ecstasy is. Do you remember the Sorted campaign, Leah Betts? I did a short research project in schools in Hampshire looking at needs assessment for young people. Way back in the day, it wasn't long after the Leah Betts died. And all the kids there thought that ecstasy was the most dangerous drug they could ever touch. And that's what that campaign did. And it meant that probably loads more young people, and indeed older people, died as a result of misuse of tobacco and alcohol. So you can see how the misuse of data. So drugs are a scourge and a menace. Alcohol and tobacco aren't. Fighting drugs is the important thing. It's really important. But not alcohol or tobacco, which aren't drugs, are they? Because that's booze and fags. Different thing, completely different. When the government was pushed to produce an evaluation framework for its drug strategy, it was pushed by the Public Accounts Committee, ultimately, and Margaret Hodge sent them away, gave them 2 years to come back with an evaluation strategy. We were thinking we were going to see some bloody data. We thought we were going to see something that you could actually measure what they were doing. They came back after 3 years, mainly because I hassled the Public Accounts Committee to revisit this, and they came back and said it was too hard. It took them 3 years to figure out it was too hard for them. But it's your money they're spending. Don't laugh. Don't laugh. It's your money. And it's our inner cities that we're paying for to put into the state that they are. One of the things I thought about that would be fun to do. Does anybody know the yellow form system for dealing with drugs? It's mainly GPs who use it for side effects, so-called side effects of drugs. And they can inform the Department of Health when drugs have a side effect, fill in their yellow form, send it off. What we need is a yellow form system for drug policy where it's not working. You can fill it in, send it in to the Home Office and tell them where it's not working. There clearly is a breakdown here in terms of the rhetoric and the reality. But one thing that's been particularly galling for us, we found it very difficult to engage with professionals across a lot of groups in terms of getting backing for this campaign. And there are a number of campaigns. One of them, which we spent a lot of time on, is peer-reviewed briefings like this under a campaign called Count the Costs, because we just want people to count the bloody costs of the global drug war. So a lot of evidence there, having no effect whatsoever. Here's a debating guide, how to win an argument. So that's also made no difference. And here's our latest campaign, Anyone's Child, which just uses pure emotion. These are parents whose children have died as a result of taking ecstasy, overdosing on heroin, who are now saying, legalise and regulate drugs because it might have saved my child and I don't want others to die in the same way. And it's partly because even we're now giving up on bloody evidence because we're going to use the emotive stuff. We also have the Bible of how to regulate drugs. This is translated into 4 languages, downloaded 750,000 times. But again, things are moving very slowly. But one of the problems for us has been actually engaging with the health community. The health community just goes along with this. Doctors, nurses, professionals right across that world, and indeed in many other sectors, have been loath to call the government out on criminalising their clients, their patients, for what are effectively social and health issues. It just isn't happening. So one of the things that I'd like to make a call for is anyone here who is involved in any profession whatsoever, which I guess is everybody here, to raise this issue, get stuck in, come see me afterwards, and let's cut the propaganda and replace it with evidence and data. Thank you.
I haven't recently seen the microphone. Thank you very much.
No problem.
Would anyone like to raise a question?
Sebastian Ewan, paediatrician. It's more of a comment than a question. I mean, I agree with what you're saying. And it's interesting that there's a general perception that ecstasy and other drugs are dangerous, and that's because every death from ecstasy is reported everywhere, and yet several children a week are dying of paracetamol overdose, and that's never reported. Yeah. So, and we all know about the problems of alcohol and tobacco and things. So it's just that we need that better, I guess, awareness and share all of the data.
Yeah, if I can just respond very briefly. It's in the government's interest not to level that playing field. If you think, we do, and you're absolutely right, there's some lovely evidence on the over-reporting of ecstasy deaths compared to paracetamol, but also alcohol and tobacco. And look at the international burden of disease that alcohol and tobacco place on everyone. It is massive. But nobody's ever talked about the scourge, the menace of tobacco or alcohol. No, not in the same way. It just isn't. Certainly isn't from the Home Office.
Well, that's a different matter.
But it's the Home Office that runs drug policy.
You're saying something completely different now. You've just moved to say the Home Office, right? And that's completely different. Because there are people who have dedicated their lives to tackling problems of alcohol and tobacco and describe it just as you describe it, as a scourge that complain about big tobacco in exactly the same way as others complain.
The government does not.
Well, that's a different issue. That's a different issue again. You're shifting your ground again. So it's not the government doesn't, or it's the Home Office.
Absolutely right. But it's the government that are in control of this.
Health campaign, meaning that I'm feeling bad for going over 14 units of alcohol a week. I don't want to feel bad about that because I really like alcohol. But they got the message over. So I mean, I totally agree with your point, but I struggle with that bit of presentation.
So which bit of it? I'm not quite sure.
When you say that people do not talk about the problems of alcohol, tobacco, they do. Whether they talk about them in the same way as some of the other things we're talking about, yeah, I mean, I agree with that. But
It's qualitatively different. We do not talk that. What there is we treat drugs, and they have always been treated as a threat. It's very clear if you go back and look at the way that the international prohibition of drugs was set up. It describes the drugs that were included under the Single Convention of 1961 as evil. Addiction to those drugs is described as evil. Now, you would never, ever see that language. You would never, ever see a prime minister describing alcohol or tobacco, or certainly alcohol, as lethal. That would not be used. Tobacco maybe, but not alcohol, because because they make money out of it. Now, a lot of this does boil down to money, yeah? But I think that the wider issue is that we have to be honest about the way that we talk about these things and the way that we engage with them and what we've normalized. And what we've normalized is to allow a system of prohibition to maintain that is totally arbitrary and disproportionate. And that is something that by the silence or the collusion of the medical profession and others has maintained. And I think that that is something that needs to be changed. It's not good enough.
So I just had a comment on what you were just saying about the government has taxes on tobacco and alcohol, and that's why you wouldn't hear it. But earlier on, just at the beginning, you were saying to take it out of the hands of the gangsters and into the government. So if we want to make all drugs just like alcohol and tobacco, I don't know, it seems like a loop that doesn't quite make things better on that respect, because then will they just do the same thing for others? So, but I definitely also agree with the point about like the paracetamol and reporting and so on, but just wanted to make that link.
It is, no, you're absolutely right. There is an issue here about, and there's another slide which I was going to put up and didn't. It's a U-curve that shows the social and health harms that occur when the government at one end prohibits drugs and basically gifts the supply to unregulated dealers and organised criminals, and at the other end of the spectrum gifts it to commercial outfits, the alcohol industry, the tobacco industry, and big pharma. Now, either end of those scales, you effectively deregulate, and you will increase social harms. You sometimes increase government taxes as well. But the point is to reach the bottom of that curve. What we need is best practice in government control and regulation in order that, yes, you get some money in, but your overall job is to protect public health.
Danny, are you saying that it should be less about morals and more about data?
I think it's about both. I don't think it's mutually exclusive. I think that it's principles that ought to underlie this thing, and that's why I started off from the outcomes that most of us would agree on, that it has to be based on agreed principles. Now, whether those are moral or ethical, philosophical, pragmatic, it's those principles then that drive the way that data is collected and presented. So I don't think it's what we've seen in our field is evidence-based, is policy-based evidence making. So we have a policy that then the evidence repeatedly comes out to back it up.
So what are the principles that your organisation would propose for?
Well, the ones that I put up earlier, which is about protecting public health, it's about value for money, it's about protecting human rights, security, development. There are a series of indicators that we can choose. You could look at the Sustainable Development Goals would be a good place to begin to see what policy you would put in place globally in order to help meet those things, because it's very clear that a prohibition-based approach is going to make it incredibly difficult for many countries to actually achieve any of those Sustainable Development Goals. They will act as active obstacles.
Thank you.
There was one more question, and then I think we need to move on. Thank you.
I'm sure Joe wanted one. He's
Yeah,
had
Joe,
the
did you
microphone
want to-
taken off him.
Where would you like to-
Just a simple.
So two more questions.
Just going back to the tobacco and alcohol thing, I'm not sure whether it matters how tobacco and alcohol are treated in comparison to drugs. Arguably, it just matters what we should do with the drug policy. So if we treat the tobacco and alcohol differently, that doesn't seem as relevant as to what do we actually do with the drug policy. Whether that's good or not in comparison just doesn't seem all that relevant to me.
It's an example of lousy practice at the commercial end. So I think that what we can see is the benefits of doing that. The benefits of controlling, however badly, in terms of alcohol, tobacco, and pharmaceuticals. At least they're not run by the mafia. At least they're not destabilizing Latin America, Southeast Asia, North America, large parts of Europe, Russia. I mean, they just has decimated vast. I'm just finishing a paper that will show that 60 countries at least all over the world have their security fundamentally compromised or threatened through global drug war. So that you can see basically where best practice isn't happening with tobacco and alcohol in terms of the industries are vastly too powerful and government isn't regulating them well enough. And then at the other end you can see what happens if you prohibit and then you just gift it to another group of profiteers. So it's useful for that, but ultimately you're right, it's the principles and then you drag the policies need to be dragged towards the center, like I say, of that U-curve to the extent that you can. Or indeed more than that. It's not just what they can. We vote for governments. We can change. If we stop voting for prohibition-based governments, I think they want it for the video.
Oh, sorry. Oh, gee, this in posterity, isn't it?
Yeah, legacy. It's your legacy. Make it good.
I agree with you quite a lot what you are saying, actually. But you want to solve the global problem comparing the data and say, I do understand your passion about it, and I understand your comparison. But isn't that the wrong way how you are pointing to the problem? Which obviously I think you are around 70 or 80 or 90% right how to solve it out. Isn't that you are targeting a wrong audience instead to target me, her, and people there saying, but actually legalizing drugs, I'm not going to endanger your children. I'm not going to increase your insecurity, and I'm not going to do these things. I'm not actually interested so much. It doesn't matter how much empathy I have that in Russia around 2 million children are dying per year because of this crocodile drug. Or the major drug is by Turkish army for Afghanistan. Or generals. I'm not much interested in that because I know that, or I think I know that. You know, the Mexico when I was in 2001 was peaceful country, and now you can't travel anywhere because they are killing each other because of drugs, which is mainly fueled by American need for it. So these all things are irrelevant. For me, what is relevant, will McGregor find a drug easily if you legalize it? And you're not addressing that, actually. And that's the reason why you're not getting message to anybody. Because I'm the one who will force the government to change policy, not you. Not big lobbies, not big this, not big that. Aren't you missing something?
That is the point of the, like I say, the Anyone's Child campaign. And if you, I haven't come here, I tried to cover a lot of different territory here, partly because I was asked to come and speak about data, which I don't normally speak about. So I've rearranged things. But the Anyone's Child campaign is specifically set up to do that, to say your child will be safer as a result of the government being in control than they are leaving it in the hands of gangsters. End of. So you haven't seen all our wares. Take a look at the website. But that is a big part of it, and I think that we can show very clearly that prohibition kills, and that whilst regulated supplies, certainly in terms of the way that the government's mishandled the regulation of alcohol and tobacco, has left young people vulnerable, tobacco smoking is going down. Hasn't been made illegal in order to do that. There are just good public health messages going on repeatedly over generations, and it's reducing.
Can I just say, it hasn't been made illegal.
Can we Gabriel, would you mind, there's a microphone just here.
I mean, you say it hasn't been made illegal.
It hasn't.
Well, this year it was made illegal to smoke in cars with children. It is illegal to smoke in public places. It's illegal to sell packets with advertising on them. It's illegal to sell single cigarettes. It's illegal to sell children cigarettes.
Yeah.
All of those things are illegal.
They're called regulations.
Funny, I think they're laws and they're crimes, and people get prosecuted for breaking them. For me, that's legal.
No one here is arguing against government having laws and regulations.
Just said smoking hadn't been made illegal.
It hasn't.
Made illegal in 90% of public space.
Listen, this is crazy. Who here has £10 in their back pocket? And if you did, you could walk into a shop and buy tobacco. That is not illegal. If you're over 18, that's not illegal. Look, we've got to be real clear here. There is a difference between laws that control how people sell things and a blanket prohibition. Think alcohol prohibition. It was made illegal and then it was re-legalized and regulated. It's not the same. And if you think it's the same, then we have a real problem here. It's really important that people make a distinction between rules and regulations and laws that govern the sale of various different substances and a blanket prohibition which does something very different on many levels.
So, I mean, let's go back to this, what's legal, what's illegal. You say
I'm sorry.
drugs are illegal. Now, I've dealt with problems in this region of legal highs that have killed people. And they're not banned yet. I mean, we're moving laws through, but they're not banned. Paracetamol was mentioned. I happen to agree with the former Chief Medical Officer of Scotland, David Carter, who did call for paracetamol to be made illegal, because I think it is a completely toxic drug and shouldn't be sold to people. And lots of drugs can't be sold and aren't legal in this country. I mean, medicinal products aren't. Lots and lots are. So there is a whole spectrum of what is legal and what isn't legal, whether it be in alcohol products or medicinal products or tobacco, and how they can be sold and or not sold. And it's exactly the same with drugs. Some are illegal, that's where there's a classification. That is why some, like illegal highs, aren't illegal. Hopefully they will be. But all of these things are spectrums. And I think, as far as your U-shaped curve is, I think we still aren't tight enough on the tobacco industry. We don't charge enough. On the alcohol industry, we don't charge enough. We make
I agree with
cheap
you.
booze available. We need more shift to
We do.
one side. And certainly, you're not making a very good case for liberalisation. Really.
I haven't called for liberalisation. I certainly didn't use that term. I called for government control and regulation and best practice thereof, same as I would for alcohol and tobacco. I'm not sure why you're arguing with me. But let's explore that later. I really don't.
I think that it's really interesting that on a Monday evening we've got animated, and I see everyone sort of leaning forward on their seat. Danny, thank you very much.
Not at all. I'll be well up for continuing later.
A very engaging provocation, exposition, call it what you want. I think, Danny, you've made a good case for there needing to be dialogue about this.
Thank you.